Welcome to Sister Callista Roy's Adaptation Model, also called RAM. My name is Huang Dat Tran, and I invite you to learn about how interactions between persons and their environments relate to nursing care. This presentation will begin with the introduction, followed by a discussion of the model's assumptions, then key concepts where I will present RAM's definitions for person, environment, health, and nursing. I will then present adaptations and the nursing process in relation to Roy's adaptation model, followed by RAM's strengths, weaknesses, and my closing thoughts. Callista Roy's adaptation model of nursing, also called RAM, considers individuals as interrelated systems, constantly trying to maintain balance while responding to stimuli. Therefore, RAM emphasizes the importance of adaptation in nursing with a focus on how individuals and groups respond to environmental changes. The overarching goal of this model is to promote adaptation in individuals and groups with help from nurses who are the facilitators of adaptation, helping patients respond positively to stimuli. This is accomplished by assessing behaviors and the factors that impact adaptive abilities. Then, the nurses intervene to enhance environmental interactions. RAM is built on the following scientific and philosophical assumptions. The first scientific assumption is that matter and energy progress to higher levels of complex self-organization. The second is person and environmental integration allow for consciousness and meaning. Third, in regard to human decisions, thinking and feeling brings awareness of self and the environment. Human decisions account for the integration of creative processes, and thinking and feeling mediate human action. Next, the assumption for system relationships include acceptance, protection, and fostering of interdependence. Person and earth relationships, persons and the earth have common patterns and integral relationships. The person and environment transformations. This assumption is that transformations of persons and environment are created in human consciousness. And finally, integration of human and environmental meanings result in adaptation. Philosophical assumptions are that persons have mutual relationships with God and the world. Human meaning is rooted in the omega point convergence of the universe. God is intimately revealed in the diversity of creation and is the common destiny of creation. Persons use creative abilities of awareness, enlightenment, and faith. Persons are accountable for the processes of deriving, sustaining, and transforming the universe. Roy's adaptation model defines person as the biopsychosocial being interconnected by biological, psychological, and social aspects that influence each other. A person is constantly interacting with a changing environment where the person is both influencing and being influenced by their environment. A person has innate and acquired mechanisms to adapt. Innate are natural mechanisms, whereas acquired mechanisms are learned. A person constantly tries to maintain balance within themselves and with the environment. Roy's adaptation model defines environment as all conditions, circumstances, and influences that encompass and affect a person's group's development and behavior. Environment is comprised of three types of stimuli: focal, contextual, and residual. Starting with the focal stimuli, these are external or internal stimuli that immediately confronts a person. This requires the most attention. Examples would be a diagnosis of breast cancer is the focal stimulus for a patient. Contextual stimuli are all other stimuli that compound or modify the focal stimuli or situation. Another way to look at this is that these are the surrounding factors that influence how a person responds to the most immediate issue. Using patient with breast cancer as the example, the side effects of chemotherapy can be considered the contextual stimuli. Residual stimuli are the environmental factors with unclear impact on the focal stimulus. Factors like past experiences or beliefs that may influence a situation. Using the patient with breast cancer again as the example, Beliefs and thoughts on chemotherapy side effects can be considered residual stimuli. RAM defines health as a concept beyond the absence of disease. Health is a continuum between health and illness, which means that everyone experiences varying degrees of health and illness throughout life. Health and illness are not mutually exclusive, they exist together. Health is a continuous journey toward integrating all aspects of a person: physical, psychological, and social. This model emphasizes the ability to cope and respond positively to environmental changes. Nursing is defined as a science and humanistic profession focused on promoting adaptation in individuals and groups. The goal is to help people adapt to changes in their environment, thus positively impacting the patient's health, quality of life, and ability to die with dignity. Adaptation is another key concept. This refers to the person using awareness and choice to create integration between themselves and the environment. There are two internal subsystems contributing to adaptation. There's the regulator subsystem, which responds automatically through mechanisms like neural, chemical, and endocrine systems. There's the cognitor subsystem, which involves cognitive and emotive mechanisms that include perceptual and information processing, learning, judgment, and emotion. These subsystems have four adaptive modes. There's the physical mode. These are the basic physical and chemical processes of the body: oxygenation, nutrition, activity, rest, elimination, the body's senses, fluid and electrolytes, and the endocrine functions. There's the self-concept group identity mode, and this is individuals' beliefs and feelings about themselves. It also relates to identity and integrity. And there's the physical self, personal identity, and group identity. And role function mode. This refers to the individual's role in society, the need to know oneself in relation to others, and the interdependence mode. And these are the relationships with others involving love, respect, and value. And this is the need for relational integrity through effective communication and relations. So how adaptation occurs? Well, it occurs on three levels. There's the integrated, compensatory, and compromised. The integrated adaptation means that life processes meet the demands of the environment. The example is when a nurse uses all available resources to meet their responsibilities. The compensatory adaptation means that the regulator and cognitor system are activated to meet challenges. The example is when a nurse experiences stress, so cortisol levels become elevated, which is a regulator subsystem working to adjust. And then there's the compromised adaptation, which means that the life processes are inadequate for environmental challenges, which results in adaptation problems, mental exhaustion, that causes someone to leave the nursing profession would be considered a compromised adaptation. Holistic nursing processes, based on Roy's model, uses the patient. We're using the patient with the breast cancer as the example again. And step one is the first level assessment of patient behavior in each of the four adaptive modes. There's the physical mode, assessing the physical responses like nutrition, endocrine, and respiratory functions. There's the self-concept group mode, which examines the patient's feelings and beliefs about themselves, like body image, self-esteem, or spiritual integrity. There's the role function mode, which is assessing the patient's role in society, like are they a parent, spouse, or employee. The interdependence mode, which is understanding their support system, their relationship with others. And step two is the second level assessment of stimuli: focal, contextual, or residual stimuli. So the example of the focal is the breast cancer diagnosis itself. A contextual stimuli would be the concerns regarding the side effects of the treatment, and the residual would be any possible cultural beliefs regarding breast cancer. Step three is nursing diagnosis of the patient's adaptive state. This is the patient demonstrating effective, ineffective, or compromised adaptations. The example of a compromised adaptation in regards to the physiologic mode may be limited arm movement due to pain after breast surgery. Step four is setting goals to promote adaptation. So for example, setting a goal to enhance body image after breast surgery. Step five is implementing interventions to manage stimuli and promote positive adaptations. Prescribing exercises to promote range of motion in the affected arm, or recommending support groups. Step 6 is evaluating the effectiveness of the interventions on whether adaptive goals have been met. An example is to assess if the arm's range of motion has improved and adjust interventions accordingly. So Roy's adaptation model has many strengths. Among them is its holistic perspective, which allows nurses to consider a wide range of factors that impact a patient's health and well-being. It looks at all possible contributing factors to a patient's health, and this model focuses on adaptations, which helps nurses understand how patients respond to their environments. This enables nurses to promote interventions that support positive adaptations. RAM also encourages individualized assessments, thereby resulting in unique interventions for each patient. Due to RAM's strengths, this model has many applications. There's broad applications across many specialties. For example, there's general nursing practice, oncology nursing, critical care nursing, mental health nursing, pediatric nursing, community and public health nursing. They all benefit from assessing how the patient interacts with the environment and or stimuli, and see how the patient is able to adapt. In regards to research, RAM is used to assess the effectiveness of nursing interventions in various clinical settings, like the ophthalmic nursing practices or the care of patients with breast cancer. There's adaptation in children with cancer and adaptations after liver transplantation. Roy's adaptation model is also used to evaluate care programs for nurses, addressing issues like compassion fatigue, burnout, and moral distress. But Roy's adaptation model has some weaknesses. This model is time-consuming, and in order to evaluate all the facets of the patient, it requires a lot of input. Because this model includes so many systems, structures, and concepts, it is also complicated. The concepts are abstract, and so they can be difficult for nurses to apply them. But before I conclude this presentation, I want to share a brief history of its development. While working with pediatric patients, Sister Callista Roy recognized children's amazing resilience and ability to adapt to major psychological and physical changes. These insights inspired her development of the adaptation model. Since Roy's adaptation model first was introduced in 1970, it has become a predominant model guiding holistic nursing practice around the world. Thank you for sharing your time with me.